How do I feel about oxygen during the last few days of end of life? Oxygen is fine for people who want to use it. We use it for comfort. It isn't going to prolong someone's life, and if we stop it, it's not going to hasten their death because we use it at a low flow. It's not life sustaining, it's just for comfort. Many people don't like to use it. They feel like it smells funny, it's drying to the nose, the tubing can cause little sores on the face and behind the ears, and that's fine. They don't need to use it. We have other ways of keeping people from feeling short of breath or air hunger, which is that feeling like they can't get their breath, and that would be through the use of morphine, which is the gold standard for treating shortness of breath in dying people. So I've had patients who didn't want it, and the family would argue with them and keep putting it on, and they'd keep taking it off. And I always say, if they don't want it, then don't make them use it, because again, it's for comfort. So if it's not comfortable, they don't need it. I worked with a nurse once who said that we are the only country in the world that puts oxygen on our dying patients. I have never found any evidence to support that statement, but I kind of believe it because it does seem that oxygen is often put on people who are dying for no apparent reason. I've had patients who had no respiratory illness whatsoever, and they came over from the hospital with oxygen on. And I would ask the family, have they been on oxygen before? No, only at the hospital. So then we can take it off because, if the person doesn't want it, it doesn't make sense. I don't know why we use it so often, because it's not always a comfort to everyone. But it's fine if people want to use it, but it's not necessary.